While I appreciate, Minister, the expenditure on capital expenditure, I mean, the truth is that during COVID in particular, the QEH, and certainly Ministry of Health, has received significant amounts of financing to be able to help us through that very difficult period. I don't think you answered the question as it relates to the human resources in terms of, because you can spend all this money, you can expand the A&E as we've seen, you can build out all of the facilities, but if we are not dealing with people, and I think the member for St. Michael South Central raised the issue, you have a lot of disgruntled people who are within the hospital, who because of the overworking, because of the lack of equipment, they are frustrated. And I am just curious whether, I haven't heard mention of a strategic plan perhaps as to what the hospital focuses on. I think we accept you can't do everything because we just don't have the resources to do it. But as the Prime Minister often says, who is coming to work to make sure that the international partnerships are taking place, that the NGO collaborations locally are being, strategically aligned on a regular basis because we recognize we can't do everything? Are we going after institutions outside of these shores to make sure that those services that perhaps they have excelled in, that they can now be transferred in terms of knowledge to the island? Because without that strategy, the poor people, the most vulnerable in this society, are the ones who will continue to make the calls and express their frustration about the long waits, the attitudes of people when they speak to them, and the inadequacy of perhaps the bed availability and those types of things. So I think the strategy is perhaps what I'm trying to get a sense of. We can, again, build all of the buildings, but if we are not dealing with our people, I think it was the CEO who mentioned earlier that the model that is currently being used in order to be able to employ persons is fundamentally flawed to some extent. If we are trying to modernize the hospital, then I believe that deconstructing the existing way in which we fill positions for the hospital has to be one of the first things that we start to look at. What does a modern QEH and polyclinic structure require in order to function? And perhaps those conversations need to be had a little higher, because obviously all of us across all of the agencies have to deal with conversations of rights of workers and labor and with unions. But I think these are conversations that the country needs to have, and perhaps in this discussion in the well need to take more center stage. I'm not here to pat the Barbados Labour Party, this administration, on its back. I deal with real issues on a day-to-day basis where people have challenges getting access to services. And I do feel that rather than us constantly coming here and talking about all the problems within healthcare, that we do need to put the issues of health financing on the table, and the various models that are available. We need to get to a point where we look at the delivery of patient care, we look at the strategy. What will the hospital focus on and what will it outsource? And are we getting those persons to sit down and really pull it apart and to try to figure out what we prioritize?
Thank you. As it relates to A&E, that's where you started, we've also had the input of the Northwell Group, and they've made certain recommendations in relation to patient communication, behavioral change, and these are things that obviously the hospital will have to address. I mentioned earlier when I spoke earlier today about the improving nursing communication and things like this that needs to be addressed, and that we were going to implement a training process to deal with that. I think we also have to be mindful that in the hospital, it is a part of Barbadian society. And society is not what it was 30, 40 years ago. This is a society that we approach each other differently. And how we relate to each other is different. And the staff of the staff, like anywhere else, come out of this society. Okay? And so it is a process. If you want to bring about change in attitude and how they relate and interact with each other, with their fellow men, then that is a process. It is something that we recognize within the QEH that has to be addressed. I know that the executive chair can speak to it, but I know that they have made overtures and made plans as to how they're going to address this. So they see it as being very important. Relating to health finance, As was said earlier by me today and then by Mr. Gill, the consultants came in, they've met with our people, and there are certain recommendations and proposals which, will be discussed and have to be discussed within the ministry and certainly within the cabinet of the Barbados. That has to be done. It is not something that is, the consultants have made recommendations. It is not so, it is not that we must follow everything that the consultants recommend. And we are addressing, looking at the matter of healthcare financing. This is, as I mentioned, is one of the issues that we have to address when I started. So I take your point, I understand. I don't see it as beating up on us. I believe that all of us have the same concerns as it relate to the poor and ordinary people within Barbados. I don't think it is. I think we all see this. All of us, I believe, come from humble backgrounds. I believe I'm looking around. I know some in front of me might not have been in this, but I'm looking around. And I think we feel it. I mean, I feel it because I work in the health system in Barbados for several years. I know that things happened then, and it was different. The matter that I'm speaking about of operating theaters running for 10 hours a day was standard. We enjoyed it. We did it. But that has changed. And of course, that was decades ago. Things have changed. And I think we need to get back to that focus, that mindset. I'm going to ask the executive chair to speak to it a bit, because I know that this is something that they have been engaging in the meetings of the executive directors.
Yeah, Dr. Christine Greenwich, Chief Operations Officer, and thank you so much for highlighting some of the challenges that we face. In terms of a strategic plan, part of the feedback and observations in general when it comes to the AED is for us to identify what standard work ought to be in the AED. Standard work is a process where, regardless of resources, we have put in place certain standards that we intend to keep. Most of the complaints from any ER AED stems around two main principles. One is communication between the healthcare team, our patients and their families. And the other very important thing is the waiting times, complaints around waiting times. So in the A&D, last year we did something called a huddle. We implemented a huddle. A huddle is just that we stop what we're doing, assess the current situation, look at actual and or potential crises that we will have to face in terms of urgency. It's a technique that comes out of another concept called team steps. We are now about to send 9 of our across the facility to Norfolk to be trained in a tactic called team steps, which stems from, again, communication with patients and also team members be on the same page, right? So we for example, the AED, we can't have 3 different titles doing the same work. It is redundant, it's a time waster, and it's taken away from the ability to keep our current assessment of the volume in the A&D current. Another issue in terms of improvement strategy is the whole process of triaging, which is someone coming into our facility and the quality of it. Studies have shown that if we can put 2 nurses there consistently, or even 1 nurse, 1 physician, consistently at standard work, that the process of the throughput and any other bottlenecks that may come up during the course of a patient experience is better facilitated. So the team in A&D, I think, are on a very good improvement process in looking at those 2 main things. It's not 100 things, but if you don't talk to patients, let them know that what is going on, or speak that grandma is okay. Or, one strategy at my place we did during COVID, a simple cell phone. Everybody has one of these pretty much. Even grandma have them. A simple call for face-to-face with someone on the outside of the A&E, being able to see the loved one and have a conversation just by utilizing a tablet or FaceTiming in terms of reducing that that stress. So I think that there are things that are not cost-related, simple things that we can do to improve and or enhance the experience of our patients. So I would have to say that the team have identified those things are very much. Another thing that maybe the DMS can mention, we figured that people are very sensitive to colors. So something like an armband in the A&E using the stoplight technique of yellow, red, and green. Identify right away, my reds are my very critical patients. The yellow are moderate, and the greens are ones that really should leave, see and treat. So, we're implementing that, rezoning location of the criticality or the critical level of that patient so that the staff can see better. We're very compressed because of space, but there are visual things that we can do to enhance that experience. Thank you.
Thank you.
Yes, thank you. Thank you. Honorable Deputy Prime Minister, you asked a fundamental question about whether or not we were thinking strategically about what it was going to take to make the Queen Elizabeth Hospital fit for purpose. Just going back to your original question, how can it meet the needs of Barbadians and respond to the kinds of complaints? Well, we recognize we're at the end of our strategic planning period and about to embark on another 3-year strategic cycle. And already we've had the opportunity of Oliver Jordan and Tracy, a group looking at state-owned enterprise reform. And this was an initiative out of the Ministry of Finance, which looked at what we were doing financially. We've had Northwell come in and do a deep dive. And we've had our own efforts through accreditation at looking at how we fared in meeting global and international standards. And it's really come down to 5 things that we believe will fundamentally transform the Queen Elizabeth Hospital, that we have to focus our energy and investments in, and are reflected in the estimates here today, or our borrowing portfolio. The first thing is investing in our human resources. We've talked about it, around it so many times this afternoon. If we do not invest in human resources, creating the number of new subspecialties in oncology, in medicine, we've just introduced a vascular surgeon. We've just brought back in a hepatobiliary and oncology surgeon. But in many instances in Barbados, we have 1 cardiothoracic surgeon. We have 1 or 2 neurosurgeons. And we are expecting with these numbers, these critical small numbers, to respond to the population needs. And it is extremely difficult, and hence the waiting lists. For instance, our Dr. Mo, who is doing pacemakers, he has a waiting list of 45 persons. Today, March 1st, is the first time since 2017 that the people of Barbados are going to benefit from a cardiac suite being open for 24 hours. This is a major milestone for Barbados. It comes out of the It comes out of the initiatives of the cardiology project. Our Prime Minister would have had engagement with regional cardiologists, which highlighted where we were in cardiology programming, and we have really had the wind in our back from the leadership at the most senior level of this government to push forward. So human resource development, human resource capacity is going to be key to our ability to respond. We have to get more people, more subspecialists in nursing and in medicine. We also have to do more in terms of providing the staffing that's required to run the hospital over 24 hours. That we don't have. Our housekeeping services end at 9 p.m. So therefore, it's only the accident and emergency that has 24-hour housekeeping. So these are the kinds of issues that we have. We still are not a 24-hour functioning hospital. So the last thing under our HR development also is around communication and how we communicate. Our Prime Minister recently challenged us, and she said, why are you bringing people in to communicate when communication is fundamental to what nurses and doctors should be doing? So unless we invest, and that's why our Team STEP initiative, the team that are going off on April the 15th, Team STEPS is the state-of-the-art approach that hospitals across the globe are using to encourage a culture of communication and transparency across the organization, paired with a concept called a just culture, which is encouraging people, we are starting at the hospital, to really report errors, near misses, to be open and transparent so that we do not have people really hiding and dodging when errors are made. The second thing that's going to transform strategically the Queen Elizabeth Hospital is technology, both in terms of information systems and medical technology. We have to be able, our CapEx plan, our 5-year plan, which we would have developed over the past year and a half, now give us a full repository of what is needed in every single discipline, Honorable Prime Minister, from oncology to cardiology to radiology. What does it need to bring the hospital to first world standard? We're no longer guessing about it. We know exactly what is required. It's approximately $135 million, $45 million in the first year. So we have that drilled down. This is significant investment that we have to be aware of. The third thing that's going to be sustainable financing. The introduction of the health levy. The people in the Ministry of Finance who conceptualized that we needed an earmark fund to be directed into health systems was perhaps one of the most significant and innovative interventions that were made in the first 3 months of this administration. And that health levy has performed remarkably, and it is now increasing and performing beyond our expectations. And finally, sustainable finances, that being important, paired with reducing costs and finding efficiencies, which we know all the areas. The Minister Walcott highlighted our dead body phenomena. And lastly, because I know my time is not unlimited, engaging better with patients. We recognize sometimes people fundamentally do not understand if they're in the public place, if they're in this private space. So we are working actively of having patients involved and working with civil society. Treatment doesn't just end, and I know you know this, Deputy Prime Minister, with a clinical intervention. Care and support is equally important. So we have an MOU with Cancer Support Services that started out just focused on cancer patients, that now we're rolling across the hospital to ensure that all of our nurses, physicians have the ability to deal empathetically with people and the situations that are encountering. So I'll stop there because I recognize my time is limited, but I wanted to say to you and give you the assurance, Deputy Prime Minister, that we are very, very clear on what is required, the level of investment that is needed, and we know as an institution that we have the support of the government to achieve the goals that we've set.
I want to